It is 8:32. We're joined this morning by our guest, Kecia Fulcher from Community Medical Clinic.
That's correct.
Good morning, Kecia. Thank you so much for joining us this morning.
Good morning.
How are you doing this morning? Did you make it in okay?
I did, and just everybody be safe. And there are a few spots still out there that are slick, but made it in no problem.
Okay, you did find some slick spots?
Uh-huh. I did, but mostly the main roads and, of course, the Parkway are clear. So
right, yeah. I come in the Parkway and well, I guess it's 69, but 69 and 24.
Right.
And I don't have any problem. I come in from Mayfield, and that's what we were just talking about actually. And you know, I live out in the county, so I come in on back roads and then hit the interstate, and even my back roads were good. So.
Yeah. It's a lot better than yesterday for sure.
Yeah, and see, but I didn't even have any trouble yesterday. But I was talking earlier to Dave, and one of my guests yesterday came from Hopkinsville, and he said it took him an hour to get from Hopkinsville. The roads are bad. So.
Yeah, there are still some bad spots out there.
Yeah,
so.
Hopefully this 45-degree sunshiny day will clear all that up, and I think we're supposed to get some rain this afternoon, and so hopefully that'll all clear up.
Yeah, expected for January, I guess.
I guess we have to deal with winter.
That's true.
All right, Kecia, talk to us about January is ovarian cancer month, right?
Well, actually, cervical cancer.
Cervical cancer. Okay, cervical cancer awareness month.
But they're both very serious, can be, very potentially deadly cancers. And so, that's why having your screenings are very important. And that's what I wanted to come as, prevention for cervical cancer.
Okay, well, let's talk about that.
Now there are vaccinations, the HPV vaccine that teenagers and young adults can take. HPV is human papillomavirus, and it is one of the causes of several different types of cervical cancer. Not 100%, but a number of those. And so there is prevention available now, and there didn't used to be. Between having regular PAP examinations and HPV vaccinations, about 93% of cervical cancers can be prevented now. And that's why I just wanted to come in and talk about kind of a health and wellness topic about this. There are about 13,000 new cases each year and about 4,200 deaths. Due to cervical cancer. And the unfortunate thing about that is most of those are preventable. And it's just amazing, even with as much as we have available to us, how many individuals still do not come in and do their screenings. It's one of those things, we tend to, I think especially women, because we're caretakers and taking care of everyone else, we're always busy. And so it's one of those things that we say, okay, we'll do it next time, or I'm not having any symptoms, so why do I need to go in? But it is one of those kind of silent things until, unfortunately, it can be too late. And one of the reasons that I specifically wanted to come in to speak about this from a community medical clinic is that my sister died, it was a year ago, December 5th, from cervical cancer at the age of 45. She had 4 children. And her situation was a little unusual, that she had a very significant heart condition and was actually hospitalized for her heart, and everyone was focused on that. And so, it was very, very serious, and we didn't know if she was going to make it from the heart condition. And she ended up recuperating from that, and some of the symptoms that she was having actually of the cervical cancer in the hospital was masked by the medications that she was taking at that time. So they blamed it on some of the symptoms that she had, back pain, pain in her legs, swelling of the abdomen. They blamed it on some of the strong antibiotics and things, medicines that she was taking at the time. So it was missed. And you would think, okay, well, she had went years without having a screening, and that wasn't true either. She had only missed one appointment after having an abnormal pap, and that was because we were so focused. She was, and all of her team of physicians were very focused on her heart condition. And so I know that that's a little bit of an unusual situation, but by the time that it was diagnosed in the first week of July, it was already inoperable. That some of the symptoms were going on for 2 to 3 months, and the type of cancer it was very invasive, and the tumor was actually too large. A lot of times there, is the thought, well, if it's cervical cancer, then I'll just have a hysterectomy and everything will be fine. And that is true for a lot of cases. Women can have surgical procedures and, cancer treatments, chemotherapy, radiation, and it take care of it. But there are those number of cases, like my sister, the tumor was too large to even be removed by the time that it was found. And you think, how could it be missed when she was in the hospital? But it was. And so that's why it's very important that you go in, you get your screenings. If you have something that's abnormal, you follow up. Immediately with it, because that it can happen. I mean, we lived through that. And it is avoidable in a lot of cases. So that's why I want to urge women to take, and I'm sure there's a lot of men that are listening to this too. So you need to urge your wives, your daughters, your mothers, to go and get their screenings.
Now, these screenings, so obviously by the question I'm getting ready to ask, I do not do this myself. Mm-hmm. What is necessary? Where do we start? I mean, do we need to go yearly and get something done? And let me also ask, does this apply to all women, regardless of whether or not they've had a hysterectomy, or only the women that have not had hysterectomies? What do we need to do?
Well, usually, it's recommended. And again, I'm in administration. I'm the CEO there, and so I'm not a physician or a healthcare provider. But there are guidelines that are based upon your age. Usually, at the time that a woman would become sexually active, then they would recommend that you start having pap smears and have those screenings. How often depends on who you ask, and also your risk factors. So that's an individual decision that you and your healthcare provider would need to make. If you're in a higher risk category, or if there are some family histories of certain things or exposures, then you may have to have them more often. But the rule has primarily been annually. At least annually. And then as we age and there are changes that take place, then it may be, it may vary. So you need to make those individual decisions with your healthcare provider who knows you, your history, your background, and your family histories. I think that would be true for any type of screenings, or particularly cancer types of screenings. It's an individual decision. And we do have an opportunity as parents now, and for young adults, to do the HPV vaccinations. And that usually starts around, they're recommending, 11 or 12, prior to having any type of sexual activity, that you're then the risk is a lot less for the HPV virus. In Kentucky, we're behind. We rank about 42 with vaccinating boys in the 13 to 17 year range. We vaccinate in Kentucky about 28.5%, where in the U.S. it's more like 37.5%. And for girls the same age, 13 to 17, we're about 44. We have about 39.7% of vaccinations, whereas at the U.S. as a whole, it's almost 50%. It's 49.5%. So we do have a way to go, and we do offer those vaccinations. There's a lot of I think, concern on parents' part that, if you have this discussion, with your children that, regarding sexual activity, there's concerns about that. But we don't ask our kids or have to discuss necessarily hepatitis or some of the other vaccinations that are required. If we just treat this like you would any type of other viral infection, then I think that we just explain it to the kids that it's a protection for them, and then you can discuss more details as you feel comfortable as they age and as they understand. Not discussing it in a way is saying a lot. If you don't discuss it. So it can be, I think that's one of the reasons that we are lower, but you need to have those discussions with your children and your teenagers to be about being protected.
What do you think could have prevented your sister's situation?
She did have the one abnormal screening, and like I said, the fact that she had a heart condition. If we had, and she had, the team of physicians that worked with her had emphasized that needed to be checked as much as her heart, it wouldn't have been missed. Her situation was a little bit different. But, back when we were teenagers and in our 20s and things like that, there were no vaccinations, for one thing. And so I think that is different now than when we were growing up, in the 80s and 90s.
How long did you say that she had symptoms before?
About 2 to 3 months before the tumor was found.
See, that's really quick.
It is very quick. And she, the cancer they found the tumor on July the 7th, and she just died December 5th. At that point, chemotherapy, surgery were not options. They did some radiation, which was primarily to help with pain. She was at Vanderbilt when it was missed. So we're not talking, we're talking very specialized care. And even with that, it was missed. And we took her to UK because they were doing some what they call seed radiation, like that they use for men with prostate cancer. They've been using it, most of them that are done in the United States, this type of radiation for women, those types of tumors have been done at UK. And we went and saw a specialist there, and he said by the time that they had found it, it was still too late. There wasn't anything that he could do with even specialized types of radiation. So, we did some genetic testing. Hers was not of a genetic variety. She wanted us to know, myself, as her sister, and then also she has a daughter, 3 sons and a daughter. And so she wanted us to know that. But that's why I'm here today is, to talk about you don't ignore any symptoms. Keep on, even, when we discussed the symptoms with physicians when she was in the hospital even. And like I said, the medicines that she wanted, it was sort of explained away. And just keep pushing. Sometimes there's a simple solution to something, and then sometimes it's not. And you just have to keep pushing, talk with your healthcare providers. I don't know that there was anything else that we could have done looking back on it to have prevented her situation. But, the saying, an ounce of prevention is worth a pound of cure. If I can, by having a discussion with you today, encourage one woman to go out there and get tested that wasn't, that hasn't had her annual, in some time. I've even talked to people in the healthcare industry. I've had friends that were nurses and or providers, and I said something, and a friend said one time, well, I haven't had one in 8 years. I was appalled. I just made an assumption, because I have always done my screenings, that everybody does, and that is not the case at all. We really need to take the time. You cannot take care of anyone else if you yourself are not healthy and not able to take care of anyone. So, we can do a lot more for our teenagers and young adults by the vaccinations, but also just getting, if my sister's, maybe at the time that she had that first abnormal one, if there had been follow-up immediately, she could have caught it in time to have surgery even, and had a hysterectomy, and we might be having a different discussion today.
Kecia, we need to take a quick break, and we'll be right back, and we'll talk a little bit more about this, and I appreciate you coming in. I appreciate you sharing your story. We'll be right back.
Here's your WPKY Weather Edge Weather Center forecast.
There's a 20% chance of rain today with a high of 45. Rain overnight with an overnight low around 49. Rain and snow tomorrow with a high of 30. Mostly cloudy tomorrow night with an overnight low around 22. Mostly sunny Thursday with a high of 39. Partly cloudy Thursday night with an overnight low around 13. Again, that's a 20% chance of rain today with a high of 45.
Your WPKY Weather Edge Weather Center forecast is brought to you by Rogers Pet Grooming.
As we begin a new year, Fredonia Valley Bank would like to express our gratitude for your business and commitment as our customer throughout the years. We appreciate our customers and hope that in 2019, as we celebrate our 125 years in business, our bank will continue the best customer service possible as a real community bank. Fredonia Valley Bank, meeting the needs of our local communities, yesterday, today, and tomorrow. Member FDIC Equal Housing Lender. 602 Cassidy Avenue, Fredonia, and 226 Commerce Street, Eddyville.
Here's a reminder from your Princeton Electric Plant Board. Meter tampering is dangerous. Tampering with an electric meter is not only dangerous, it is dishonest and against the law. Stealing electricity by tampering with an electric meter may result in your arrest and can even risk your life. Tampering with meters results in increased utility bills that everyone has to pay. If you see anyone tampering with an electric meter, call the Princeton Electric Plant Board right away at 270-365-2031. Princeton Electric Plant Board, Princeton's #1 energy source. Imagine this. It's late at night, it's cold and dark, and you have a flat tire. One never knows when old Betsy's gonna cause you problems. There's only one place to call, Wallace Towing and Recovery in Princeton. Wallace Towing and Recovery is a 24/7 towing and recovery service. You can count on Wallace Towing and Recovery to get you safe and back on the road or to a repair shop. Wallace Towing and Recovery will jumpstart your vehicle, change a tire, deliver gas, unlock a door, or haul it to the garage or scrapyard. Wallace Towing and Recovery has you covered in Princeton and surrounding areas. Call Wallace Towing and Recovery. Check them out on Facebook, and when you need a tow or roadside help, call Wallace Towing and Recovery at 270-963-9081.
Herb Hayes Furniture, always the best.
Amazing midwinter clearance sale deals can still be found at Herb Hayes Furniture and Mattress. Absolute wall-to-wall savings. You can get an Ashley Sierra Sleep Queen Size Adjustable Basin Mattress, memory foam or hybrid for just $5.99. Everything is reduced by interest-free for up to 3 years. Herb Hayes Furniture and Mattress, where you always get the best selection, the best furniture at the best price. On the Boulevard in Hopkinsville.
Herb Hayes Furniture, always the best.
1580 103.3 WPKY. Good morning. It is 8:50. We are still talking to our guest, Kecia Fulcher. She's here today. It's about 33 right now. Hey, I do want to get a quick birthday in here that just came in. Debbie Yates, happy birthday to her. Listen in at 7 o'clock every morning for the birthday list. We do happy birthday, happy anniversary at 7 o'clock every morning. So, Kecia, we were talking a little bit during the break. So I personally, I didn't know her, but I have a friend who, her sister-in-law died of ovarian cancer. Mm-hmm. And she didn't so much ignore her she sort of ignored her symptoms, but didn't really. She was similar to what your sister story. She thought it was something else.
Right.
She had endometriosis, mm-hmm. and so her symptoms that she was having, because she'd been used to that for years and years, and you just have to deal with it when you have endometriosis. She just thought that's what she had, and so she was just dealing with it, going on about her daily life and trying to, push through. And when the pain got bad enough that she finally had to go, see if they could do something for her, turned out it was not the endometriosis. It was
the
cancer.
ovarian cancer.
And it was so far advanced that they, similar to your sister, they couldn't do anything for her.
Right.
So I think, it's hard. It's hard to know what our bodies are telling us, because my body talks to me every day.
That's right.
And it doesn't always say nice things, but I don't want to run to the doctor every time, every time I feel, excuse me, but every time I have a little gas, I don't want to run to the doctor.
Right.
But then again,
that's why I think the screenings are so important, because that gets you in at least once a year, or what we would call sometimes an annual wellness exam, where you sit down with your healthcare provider. A lot of times you don't even have to, they don't have to do a lot of physical things. It's more of a discussion where you're at with things. And then if something comes up that is of concern, you can have that discussion. They can, decide with you, how, whether it should be pursued with other types of exams, or blood work, or whatever may need to be done on an annual basis for your own health. I mean, I was thinking this morning in preparing for this that a lot of times we spend more time taking care of our cars and maintenance than we do ourselves. And you put it up in your window, and so many miles, you have to take it in. Really, we need to do that. And if you have a chronic health condition, let's say, you and I were talking a little bit about diabetes during the break, diabetes, hypertension, some of your, you need to be in to your healthcare provider with diabetes probably every 3 to 4 months, with hypertension at least twice a year. I mean, there are certain chronic health conditions that you and your doctor decide how often you need to come in. That way they can assess your medications if there needs to be changes, or if you're having some symptoms that are different than what you've had in the past, then you can help discover maybe why and what needs to be done to follow up on that. You're right, our body does tell us things, and sometimes we can ignore it and go on and think it's just the usual, it's arthritis, or it's, older age. I had a friend that he was having some issues, and he said, I just really thought I was getting old, and it was older, and that's what it was. And when he found out, and they adjusted his medicines, and he's doing better. But I'm just saying, you have to that's why those screenings, coming in and doing at least once a year, is very important. We have 3 locations. We have the one here in Princeton at 310 Hawthorne. We're about 2 blocks up from the square, so we're not hard to find. And then we have the location in Hopkinsville at 1102 South Virginia Street. And then we have the clinic in Oak Grove at 244 Thompsonville Lane. And so we do have 3 different locations for the people in the area, to one that's convenient or closest to you. And we're open from 7:30 to 5:30. So even in this time of the year, when it seems to be we're starting flu season, seeing a few cases of those, we are open at 7:30. We do take walk-ins, and but if you don't want to wait, then it's always good to call ahead, and maybe they could tell you a time where we're not scheduled as heavily during the day, so always call. But of course, if you can or you need to get in, then come on in the mornings, and they can check you out and see if it's just something viral or a flu, or if you have some more serious health conditions going on.
And are your fees normal fees? Do you have like an assistance?
Yeah, I appreciate you bringing that up. Yeah, we take all insurances. We are a federally qualified health center, which is a Section 330 health center, meaning that we receive grant dollars from the federal government. So some of your taxpayer, money at work for you, essentially, so that if you have no insurance, or let's say you're underinsured, a lot of times people's deductibles are very high, and they won't go unless they have something catastrophic or having to go to the hospital or something like that. We don't want that to happen. We want people to come in, and we make it affordable. We have an adjusted fee schedule. It's based on income and number in the family, and so we can do payment plans plans, our whole goal is prevention or taking care of your health conditions before they become catastrophic, which is bad for you, for quality of life, and it's also financially can be, very detrimental to, everyone. And that's why fortunately, HRSA, which is the Health Resources Services Administration, at the federal level, they are one of the governmental entities that's still working right now with the partial shutdown. They got their federal allocations in early in the fall, and so they are still working. And, that which isn't true for, unfortunately, for some of the others. But, we do have that assistance available if it's necessary. And even if you have insurance and you cannot meet that deductible, then we will work with you because we're, have use taxpayer grant dollars. We can do that.
Okay.
There's no reason financially that you should not be able to come in and get help.
All right. And, back to why we don't go, I think financially is some of it. Taking off of work, having to take off work. A lot of us work on hourly, and so we do lose money when we have to take off work to go to the doctor.
Right.
Or not having proper insurance.
Mm-hmm.
Or the whole not wanting to feel paranoid.
Mm-hmm.
So maybe we just need to get over that.
Yeah.
And we need to realize that, looking out for our health is not paranoia. It's looking out for your health.
Yeah, it's just like like I said, maintenance on your car. You just got to think about it. This is what I got to do to make sure that I'm still in good shape and still capable of doing all my activities. Because if you're in the hospital, you're going to be losing money that way. Your quality of life. So it's just to keep you from having those types of catastrophic care. One thing that I did want to mention before I leave today is that we also had just received notice this last week of a colorectal cancer screening grant. It's money that comes from the CDC. Kentucky has one of the, we have some of the worst cancer rates in the United States. And this was a national grant that the Department of Public Health got from the CDC, and then those of us that are federally qualified health centers or rural health centers could apply for it. So we just received notice of $50,000 that we can use to help our patients get colonoscopies free of charge. We've got to work out some of the deal with the contract with local providers, but we're really looking forward to that because a lot of times if people even have to pay for part of it, they say, oh, well, and then they don't get it. Mm-hmm. So these will be provided free of charge. And it's a 2-year grant, so we will probably be able to help serve 45 patients a year. So, a little less than 100 people will be able to get colonoscopies that wouldn't have those available. We apply for grants for different types of conditions. We have a cardiovascular grant. We have a mental health and substance use disorder grant. And we can come back and I can talk about some of those another mm-hmm. time. But we do apply for those grants because then that allows people in our region to be able to get better health care.
All right, Kecia, I appreciate all the information you gave us. Tell us one more time the location for Caldwell County and the number that we can call if we have any questions.
Right. It's 310 Hawthorne Street. Again, we're 2 blocks up from the square, the former location of the health department for people that have lived in the area for years. The number is 270-365-0227. And if you need more information about the other locations in Hopkinsville and Oak Grove, you can call that number and we can get you over to them. So it's 365-0227. And you can call for a wellness appointment, or if you're not feeling well today, you can call and we'll get you in and get you taken care of.
All right, Kecia Fulcher-Community Medical Clinic.
Right.
Thank you so much for joining us this morning.
Thank you, Misty.
Serving Caldwell County since 1950. We're 1580, 103.3 WPKY Princeton.